These are the video answers for question set number 12. Let's get started. First question, women with polycystic ovarian syndrome can have decreased sex hormone binding globulin, which causes hirsutism. So what can an increased sex hormone binding globulin cause in men? Well, this sex hormone binding globulin is a carrier protein, a transport protein that binds to lots of different hormones like estradiol and testosterone, and it carries them in the blood. So if you have increased sex hormone binding globulin, you're going to bind up more of the free testosterone in the blood. You might see some gynecomastia. The next part of this says, what's the general mechanism of action of the steroid thyroid hormone? So steroid hormones and thyroid hormones work inside the nucleus. They cross the cell membrane, they go through the cytoplasm, they cross the nuclear membrane, and then inside the nucleus they affect gene expression. So that explains why these hormones work more slowly than, say, epinephrine, which can work very, very rapidly. Next, a patient comes to your clinic because he's not been able to extend his wrist for the last 3 days. Upon further questioning, you discover that 4 days ago, the patient passed out drunk for an entire night while his arm was draped over a chair. What's this patient's condition called? Well, this is called a radial nerve neuropathy, sometimes also called Saturday night palsy. Now, you don't want to confuse that with Saturday night fever, which is where you wear really wide collars and bell bottoms. The next part of the question says, does the regeneration of neurons occur both in the CNS and the peripheral nervous system? So the short answer is no. Regeneration does not occur in the CNS, but it can occur in the PNS. The secret to this lies in the white matter. So what's white matter made of? Myelin. And what type of cells myelinate the peripheral nervous system? Schwann cells. And these Schwann cells secrete a chemotropic growth factor that enables regeneration. Now what type of cell myelinates the CNS? These are the oligodendroglia. And these cells actually secrete a chemical that inhibits axonal growth. So there's no regeneration in the central nervous system. And then last, what's the rate of growth of a new axon in the peripheral nervous system? These axons grow at a rate of about 1 to 2 millimeters per day, so very, very, very slowly. Next, a 36-year-old malnourished woman comes to the ER with abdominal pain. She has a fever, abdominal tenderness without rebound tenderness, and anorexia. Her white cell count is markedly elevated, and her RDW is high. Patient reports having had a bowel movement this morning. She's not nauseated. A small bowel follow-through study, which is where you give oral barium contrast and you do a series of abdominal x-rays and you watch the barium pass through the small bowel. And in this case, that revealed skip lesions and also string sign in the terminal ileum. So what disease does this patient likely have and what drugs can be used to treat it? Well, this is a classic presentation of Crohn's disease. Skip lesions and string sign are big buzzwords for Crohn's. You can also see transmural inflammation of the bowel wall and a cobblestone-like appearance of the mucosa on endoscopy. And then the drugs used to treat Crohn's include 5-ASA, which is a salicylate, and glucocorticoids. And then for more severe disease, we add on azathioprine or 6-MP, which are both immunosuppressants, and then anti-TNF-alpha drugs like infliximab and adalimumab. The mab ending on those tells you that those are both monoclonal antibodies, and they're antibodies that actually bind to TNF-alpha. Next, what's the equation for determining a drug's volume of distribution? So volume of distribution equals the amount of drug in the body divided by the plasma drug concentration. And then what types of disease would alter the volume of distribution of a highly protein-bound drug such as ceftriaxone? So both liver and kidney disease can alter the volume of distribution of the drug. With liver disease, you have decreased amounts of drug-binding proteins in the blood, since the liver is generally responsible for synthesizing binding proteins and plasma proteins. So with fewer binding proteins, there's more free or unbound drug which can distribute into the tissues, and that leads to a decrease in plasma concentration. And then with renal disease, plasma protein binding of many drugs is impaired, which often results in a larger apparent volume of distribution. Next, the parents of a 5-year-old girl are concerned because their daughter has night terrors, sleepwalking, and enuresis. In which stage of sleep do these occur? So night terrors, sleepwalking, enuresis all occur in stage N3 of the sleep cycle. And then what medications shorten this stage of sleep and thus are useful in treating night terrors or sleepwalking or enuresis? These are the benzodiazepines such as lorazepam. Next, a 30-year-old man begins to develop shortness of breath and cyanosis even at rest. Exam reveals clubbing and a systolic murmur. He mentions that he has had this murmur since childhood. So further workup reveals a large VSD and pulmonary hypertension. The patient's diagnosed with Eisenmenger syndrome. Describe how this syndrome develops. So basically you have an uncorrected VSD or an ASD or a PDA, and that's going to increase the pressures in the right side of the heart, you're going to get progressive pulmonary hypertension. Then as pulmonary resistance increases, you're going to get reversal of flow in the heart and a right to left shunt, and that's going to cause cyanosis. It's that flow reversal that's characteristic of Eisenmenger syndrome, that change from a left to right shunt to a right to left shunt. Next, a 48-year-old woman who's taken oral contraceptive pills for the past 15 years is concerned because she's not experiencing menopausal symptoms like the rest of her friends her age. What's the primary reason why menopausal women experience symptoms, and why isn't this patient experiencing menopausal symptoms? So menopausal symptoms occur because of a lack of estrogen, and this patient isn't having symptoms because she's getting estrogen in her oral contraceptives. And then what symptoms and conditions are attributed to the changes that take place in menopause? So the main symptoms are hot flashes, sleep disturbances, and then vaginal atrophy and vaginal dryness. There's also an increased risk of osteoporosis, an increased risk of cardiovascular disease like coronary disease and stroke. And again, these are all related to the lack of estrogen. Next, what medications are known for causing erectile dysfunction? So most antidepressants, especially the SSRIs, and also antipsychotics, spironolactone because it has anti-androgen effects. Ketoconazole also has anti-androgen effects, and it inhibits synthesis of steroid hormones in the adrenals. The H2 blocker cimetidine because it stimulates prolactin release, and that can reduce testosterone levels. Now, other H2 blockers aren't really a problem in this regard, so don't think of this as a class effect. Just remember cimetidine. Several blood pressure drugs can do this. We already mentioned spironolactone, but also sympathetic blockers like clonidine or methyl-dopa or guanethidine, and then also the thiazide diuretics. And classically, we say beta blockers cause erectile dysfunction, but the current thinking is that beta blockers only contribute minimally to erectile dysfunction, and that a lot of it may be a placebo effect. In one study, only about 5 out of every 1,000 patients on beta blockers had erectile dysfunction that was really from the beta blocker. So that's half of 1%, so that's a really, really infrequent problem. Next, a newly married couple was enjoying a honeymoon on a beach in Mexico. A few days into the trip, the two began complaining of abdominal cramps and watery diarrhea. They did not have fever. Which type of Escherichia coli causes the very common traveler's diarrhea? Well, this is enterotoxigenic E. coli. It causes a watery diarrhea because of the toxins, but there's no invasion or inflammation, so this is not a bloody diarrhea. Now, if you see bloody diarrhea, you need to think about tissue invasion or maybe tissue inflammation. Some organisms actually do invade the tissue, so the differential for bloody diarrhea is different from the differential for non-bloody diarrhea. And our last question, what's the rule of 2s associated with a Meckel diverticulum? So it's 2 inches long, it's going to be located within 2 feet of the ileocecal valve, it affects about 2% of the population, and it usually presents in the first 2 years of life. So that's it for set number 12. I'll see you next time.